Now I forget.
Clients, clinical, email, materials, partnerships.
Just every Tuesday at Charlie House.
Transferred to the counseling center or to speak to our office administrator, please press 0.
Let's call Angela. This one will be fun if she answers. Oh, it's still really early. Angela, good morning. I just want to give you a call, have an update, and I just want to tell you I'll be seeing you later today. So talk to you soon. Bye.
I'm a social worker. I do have clinical background. I live in Queens, so my territory is Westchester and the Bronx.
On Thursdays, the theme for the team is Thoughtful Thursdays. So we started with our whys today. I started with my why today, about my mom, and I talk about her a lot, but my dad is also in it too, so that's what our theme is today. Like, something that's really important about this job is actually being a member of the territory you're in, whether or not you actually live there. Like, I don't live in Westchester, but I spend 4 or 5 days a week in Westchester, and that's really important, right? Because when you're in the field of mental health, whether you have like background experience, like clinically, like I do myself, or you're just wanting to make that impact, the people around you need to know that. So being a part of things like this literally shows them that, hey, Charlie Health, despite being a virtual program, is very much integrated in the community, and that's why we're here to serve them.
Yeah, I should have. You're good. Okay, this is me right here. Switch
Hi, Mary. It's Andy. I have a few updates for you. Hi, Alex. It's Andy.
Hi, Andy. How are you?
I'm so good. How are you today? Hey, y'all. How are you? Good. Okay, thank you. Hi, sorry. I brought some friends with me. We'll do rapid fire. That's totally fine. So let me ask you this. When someone is that high acuity mental health patient, what does that patient look like?
I think self-harm is definitely a big one.
We have a couple people who have bipolar, borderline is a big one, eye trauma, lots of trauma.
Every substance use center does good work, but it's not always also picking at that mental health piece, which is what I love so much about Lexington. When patients were coming to like the day program, were there any barriers that you found when they were trying to access your care?
How to get there, taking a break from their day-to-day to get the help that they need was difficult for them.
Yeah, it's really about improving access at the end of the day, as you know, and so knowing what our community needs is like the most important part. Yeah, let me give you some pamphlets right now.
Thank you.
Of course. The pamphlets are really fantastic
Yeah.
to help walk through, of course, families through, but you have me, so give me a call. That's my direct phone number. It's my direct email on there.
No, I found it.
Okay, good.
Yeah.
Thanks for coming with us.
Bye.
Bye.
I will talk to you later.
Talk to you later.
Bye. She's so great. I love her.
Actually might have a virtual meeting.
Okay. Would you want to just go back in there to take it?
No, because car desk.
Car desk. Uh-huh.
Car desk.
Okay.
This is car desk, often used for eating, not for me. It's for meetings. We hook it on like so. Bring our laptop. And then we have our mobile office. So we can do anything, anywhere, anytime.
And the home visiting program and for the Envision program, and then I work one-on-one with the developmentally disabled adults in their homes.
Oh, wow. Well, thank you for all that you do. Absolutely. I know how challenging the work can be, and going into someone's space and not taking it home with you can be difficult.
It's a waiting list forever.
Yes, that was my experience. In being a clinician myself, it was hard to turn people away from my clinic, right? Because the wait list was 50, 60, 70 people long.
It is definitely a need. As I said, the in-person is a lengthy wait list that seems to just continue to grow, with not just with our agency, with other agencies, because I have sent her outside of our agency to get care, and it's still the same process. So there's a waiting list.
Yeah.
Call every week, then it's call every month, and still nothing.
Right.
So how can I, because I now have these two, especially these two right now, how can I move forward with getting them these services?
Amazing. So we have some time left. We can do them together right now.
Yeah. Thank you so much, Andy.
Awesome. Bye.
Bye.
Okay. I get excited like to call him every time.
When you've finished recording, you may hang up or press 1 for more options.
Ignoring me on days I tell you I'm coming, Marcos. What have you become? Come outside when you can. I'll see you soon. Bye.
I'm Paxton. Hi, I'm Andrea. Nice to meet you. It's cold.
It's a raw day, and you should even the weekends. It's even 7.
Did I not say this guy would have something to complain about? I was like, all we do is yell at each other. It's not going to be a good look.
So I was telling her if she knew any clinics around, because she couldn't. And she
Charlie
gave me Andy's email.
Really?
Yeah.
Dr. K was there today.
I love her.
So I was like, I love your boots. She goes, Jimmy Choo, darling. What are you going to do next? Yeah.
Nice meeting you.
I'll see you guys soon.
Thank you. Congratulations.
Take care.
Can I ask you actually to send me an email follow-up just with like a name and number if you get verbal consent from them? Just because that way I can only promise I'll make sure. Yep, I'll reach out to them if I don't hear from them, in like a day. Amazing, sounds good.
Thank you.
Of course, Erica, talk to you soon. Bye.
Referral?
Yep.
Nice.
And I try, so that happens a lot, right? Where they're like, I'm gonna have them reach out to you, and I'm like, no, send me their phone number. Oh. We do this work because we love it, and so if we want to help 10 people every day, that's great, but also is helping one person every day is really great. It's really amazing, actually, at the end of the day, looking back on all the things that I did, it sometimes blows my own socks off of wow, I talked to so many people, I went to so many places and did so many things. It's still building relationships, maintaining relationships, and spreading the good news about our program. So a lot of the same.
You're thinking too loud right now.
Yeah.
I can't do this.
Very good.
No, it's
I can even see your face.
Yeah.
Speeding. Are you speeding?
So for me, clinically speaking, my background is, I'm a social worker. I used to direct therapy. I worked with pregnant women and children up to age 5. And the reason I did that is because my mom struggled with mental health issues my entire life. She struggled with bipolar, later schizophrenia, and substance use disorder. And it really impacted every aspect, not only of who she was, but who I was and could become, right? And one thing she did really well was try her best for the first 5 years of my life. And I realized that if you get in early and can have a strong positive attachment early in life, it makes a difference. And so I credit my mom for a lot of the hard work she did there. And I don't think I would be good at this job if I didn't have that experience, which doesn't mean you have to have trauma in your background to do a good job. But I think that it's why I can lead with empathy and lead with relationships, because I have immense gratitude for the opportunity to continue to do that for people's lives through Charlie Health. For those that don't get to have early intervention, right? For those that are still struggling, I get to save my mom a little bit every time. And so if I can give other people the opportunity to thrive in whatever they do in their life by being that first door to Charlie Health, then that makes it worth it.